Head and neck cancers account for more than 64,000 new cases a year in the U.S. And in this week's story, I'm weighing in on the risk factors and treatment options available for patients.
Promotional consideration for the following is provided by the Oklahoma Proton Center.
Breast cancer is the most common cancer in the U.S., followed by lung and prostate cancer. But what do you know about cancers of the head and neck? Dr. Brandon Pearson sees it every day in his office.
Cancers of the head and neck, or anything that originate in those areas, we will commonly subclassify to areas such as the oral cavity, the throat or pharynx, the area around the vocal folds or the larynx, as well as salivary glands, thyroid cancers, and even advanced skin cancers.
And says it accounts for 3 to 4% of all new cancer diagnoses each year, and often the signs aren't so apparent.
I will usually see patients that have maybe 2 to 3 weeks onset of a persistent lump in their neck, and initially may not be concerned because it doesn't hurt them. It could be a misunderstanding that cancer has to have pain all the time. It's simply not true.
Moses is one of those patients and was soon diagnosed with tonsil cancer.
Didn't know that I had a cancer. My tonsils weren't sore, they didn't hurt.
As a result, he had his tonsils removed ahead of receiving proton therapy, wearing this device, which specifically targets the cancer.
I already knew going in that this was going to save me time for the rest of my life because I wouldn't have to shave this side of my face anymore. But I said, we're talking about the goatee now, and that's not going to get it. But he was able to go in and modify those resists so that it would pull the radiation back, and then it saved this part of the goatee.
But Dr. Pearson says this is just one of many ways to treat cancers of the head and neck.
Treatments can usually be categorized into one of 3 or even all 3 methods. This would include surgical excision of the tumor, radiation therapy provided by a radiation oncologist, as well as chemotherapy, which may be provided by a medical oncologist.
There are multiple risk factors, but you should be aware of the top 3.
The 3 main risk factors would include tobacco use, alcohol in excess, as well as human papillomavirus, which is a sexually transmitted disease.
It's still unclear what caused Moses' cancer, but he's grateful to ring the bell as a cancer survivor.
It was really just an overwhelming experience, and it was unexpected because I don't think of myself as overly emotional, but I was overcome with emotion when that happened, and it was a great feeling.
And we're just glad that Moses is doing well. Taking control of your habits can reduce your risk. Practicing safe sex, cutting back on drinking and smoking, and use sunscreen to protect yourself.